This video is about Pectoralis Major, which is on page 89 in your book. Pectoralis Major, put this down here, covers this whole area. So it's the whole chest wall here. Anything that you can palpate, touch here, this is all pec major. So pectoralis major, it's called pectoralis major because we are on the pectoral area, right? And if there's a major, then there's probably going to be a minor, right? Pec major is the superficial muscle in this area, right? Because we're talking about superficial muscles of the shoulder in this unit. Pectoralis minor is going to be deeper to that and much smaller actually, and we'll get to that one later. So let's get right into pec major. All right, so we were on serratus anterior. We're just going to go to the next page here. Your book does have palpation instructions, but since we are going to be doing that in class, we will hold off on that until then. All right, here we are. Pectoralis major. So broad, superficial muscle. It's actually pretty dense. So it's a lot denser than trapezius or latissimus dorsi. It is a pretty powerful muscle, pretty powerful shoulder adductor. And if you adduct your arm right now, you can probably feel pectoralis major engaging. It's a very strong muscle. Now, pectoralis has a lot of attachments. It has clavicular attachments, sternal attachments, and costal attachments. C-O-S-T-A-L. Costal refers to ribs. It is not coastal. It is costal. See, there's no C-O-A. It's costal, refers to ribs. Okay. All right. So all of that is the origin, and then it has kind of a small insertion over here on the humerus. So let's take a look at that. All right, so the origin, as I mentioned, lots of origin, medial half of the clavicle, sternum, and cartilage of ribs 1 through 6. So if you like to write it out, or if you're a visual learner, again, 1 through 6 rather than 1st through 6th ribs. All right, let's repeat that. So medial half of the clavicle, sternum, which is this bone right here, the breastbone, that's the whole sternum. And then the cartilage of ribs 1, which is way up under here, through 6. The insertion is the crest of the greater tubercle of the humerus. And remember, here are our tubercles, right? Greater and lesser. The crest of the greater tubercle, right there. Okay. So greater tubercle's right there. There's the crest of the greater tubercle. Medial half of the clavicle, whole sternum, and cartilage, which is this part right here and here and here and here. You see there's a little division right there and right there. That is where the bone of the rib meets the cartilage of the rib. So ribs are bony, but they also have a lot of cartilage where they attach. So that would be the costal cartilage. Right there and right there and right there, that's all costal cartilage. Okay. Now, actions. Pec major. We have different fiber directions, and you could see that in this illustration here. So you have a fiber direction that goes this way, fiber direction that goes this way, and fiber direction that goes this way. And we've divided it up, clavicular, sternal, and costal fibers. All right, so all of the fibers of pec major adduct the shoulder. So we already mentioned that. That's one of the major actions of pec major is adduction of the shoulder. Okay, if you bring your arm out like this and then you bring it down towards your body, you can easily feel pec major contract. Medial rotation of the shoulder. Well, sure, let's take a look at that. Medial rotation of the shoulder. So if these contract, they are bringing this area closer to the midline, both in adduction, and if you can visualize that this actually can roll the humerus towards the midline of the body as well, that would be medial rotation. And we'll show that on visible body soon. And all of the fibers can assist to elevate the thorax, this is the rib cage, during forced inhalation. Okay, because they attach to the ribs, because the fibers attach to the ribs, all of them, right? Here and here and here, they can assist to elevate the ribs during forced inhalation. Assist. They are not a primary elevator of the ribs. And that's only really when the arm is fixed, okay? So again, it's kind of like serratus anterior. If there's some reason the arm isn't moving at the moment, maybe it's in a sling or cast, or maybe you injured your shoulder, or maybe you are just holding yourself up with your arm for some way, like maybe during a yoga pose, then pec major can help to lift the ribs in forced inhalation. All right, so the up fibers and the lower fibers are slightly antagonistic to one another. The upper fibers can flex the shoulder, while the lower fibers extend the shoulder. And that's hard to visualize. The extension part anyway. The flexion, pretty easy. The extension is a little harder. You can see that these fibers right here, these are the upper fibers, they can easily pull the humerus into flexion, okay? The lower fibers pulling the arm into extension, that's a little harder to visualize, so we'd have to go into visible body to see that. The upper fibers can also horizontally adduct the shoulder. So if we recall, horizontal adduction first brings the arm into flexion and then across the body towards the midline. That's horizontal adduction. Horizontal adduction. Okay. All right. So let's see this muscle here. Make that smaller. So what I did this time is I actually added sort of everything that visible body has. So I put in the color on the bones for the origin and the insertion. I added all of the origins, see? And the visible body actually talks about each individual origin rather than the origins as a whole. So don't let that confuse you. So like right here, it'll say the clavicle. Right here, it says manubrium. Well, the manubrium is this top part of the sternum. So it is the sternum. It's just, it has a separate name because it is the top part. Here we have body of sternum. That's this part right here. And then down here, it'll say, you know, cartilage of the fourth rib, etc. So we're just saying medial half of the clavicle, sternum, the whole thing, and then the cartilage of the first 6 ribs. Okay, so over here we have the insertion. You can see that it's in blue. We have the blue pin, and it just says insertion humerus, but we can get more specific than that, right? Crest of the greater tubercle of the humerus, to be exact. So I also added nerves here. See, that's the lateral pectoral nerve if you click on it, and that nerve innervates the pecs. So in other words, sends the signal from the brain to get the pec to contract. And then I also added blood vessels. So thoracoacromial pectoral branch of this major branch, which is the axillary artery. Okay, so you can add all this stuff too if you like to get a more complete picture. We don't have to do that right now, and I'm certainly not going to make you, but like I said, it does give a more complete picture to what's there. All right, so I'm going to fade pec major for a second. So you can see everything that's underneath, all of the nerves and the blood vessels that supply pectoralis major. All right, let's put that back on. Okay, cool. So what we're going to do now is we're going to go into the actions. So we had shoulder flexion, pardon me, shoulder medial rotation. Why is that upside down? That's weird. Okay, so shoulder medial rotation, you can see, is provided by anterior deltoid and pec major, right? All right, let's just go into actions. Let's just do this. This will be fun. All right, so here's horizontal adduction. You can see, again, anterior deltoid and pec major here. Horizontal adduction. Easy, easy, easy to see, right? Okay. How about extension? So this is where I want to show you. Yes, that's the posterior, but let's talk. Oh, there it is. Okay. Shoulder extension. It's hard to see that. That's pec minor. I guess it didn't put pec major on here because it's just showing, we wanted to show you the posterior portion, but that's okay. Wonder if it'll show me. Okay, well, anyway, let's do medial rotation. There it is. Okay, so you can see the fibers of pectoralis contracting and providing medial rotation. Sure. These are easy to visualize with superficial muscles because you can see and feel what it is that they do. Go back up here again. Horizontal adduction we saw. Shoulder adduction. This is right, just bringing it closer to the midline. And it shows you from the back, latissimus dorsi. But we want to see pec major. There it is. See it contracting and bringing the arm closer to the midline. Excellent. Okay. All right. So for pec major, you do have a little bit of additional information on page 89, the difference between white meat and dark meat on birds. Remember, birds actually have really big pectoral muscles because they have wings. We also have large pectoral muscles, but not the same as birds. And if you eat meat, so you eat chicken and turkey and things like that, the breast meat is basically pectoral muscle. So that's what you're eating when you eat the breast meat of a chicken or a turkey. So it tells you a little bit about that. All right. As far as palpating pec major, remember I said all of this and through here is pec major. So if you put your hands right here, you are palpating pec major. But I encourage you to go through some of the actions while you have your hands on pec major on yourself, because a lot of these actions are very easy to feel. Especially that one. Ooh, there we go. So you can feel the borders of pec major as you go through these actions and feel really where this muscle is. It is large and it does go underneath the breast tissue. So we'll have to take that into consideration when we're palpating in class. If you would like to check out the palpation on page 90 before we get to class, it'll give you a better idea of how we're going to approach this. Okay. And that's it for pec major.